all the operation theaters were nearly closed, and the respirators were used for ventilating patients. So we built intensive care units from the operating theater. So we had for a number of months we nearly had not the possibility to operate because we needed all the respiration machines. It has been a disaster here in the Netherlands, and now the interesting thing is the amount of positive PCR positive citizens is still quite high, but because they all have been vaccinated, the amount of cases now coming into the hospital and into the intensive care is very, very low.
So now you have almost number of patients per day in the ward, like for intensive care unit?
I think, I don't know the figure of today, but I think there are now 6 patients in the wards with COVID, and we used to have 60, 70. And that's because of vaccination, but I can give you the exact numbers.
That's enough for today.
Yeah.
Yeah, there is a challenge for vaccination program in Tanzania. Especially there are a lot of rumors of the quality of the vaccines. They are talking about why it is too quick. Like the vaccine came to the market very quickly when we compare to other previous vaccines. Yes. With the process.
Well, it has to do with two main reasons. So this is not a classic vaccine. It's an RNA-based vaccine.
Yeah, mRNA and DNA.
And that technology is a patent which on patented cells, which was made here in Leiden, and Janssen made this vaccine. It took a while to have it approved, and the other big factory here, also next door, is for AstraZeneca. It's also made here here on the Bioscience Park, and as a result of that, massive production based on this new technology. But when the technology, number one, the technology was suitable for viruses, and number two, the technology was available, and then it was a very, very quick working together of scientists.
Yes.
To get the thing running here in the Netherlands, the vaccine campaign, and it was so for all patients of the Netherlands were centralized. The data were centralized and used for everybody in open access. So we learned very, very quickly what was going on from each other, whether you were in Leiden or in Utrecht or in Groningen. All these patients were used. The material was used throughout the Netherlands. Open access, very important. Frits Roosendaal, you know him.
Yeah.
He was very important in the epidemiology of the whole thing.
Yeah.
And he organized this exchange through the Netherlands.
Yeah, of course. Now again, the technology is there, and the capacity of scientists, also the capital, the economic availability of fund to fund the progress. Yeah.
But so when you have let's say a vaccine costs about let's say 100 euros, the whole thing, including registration, whatever. But one day on the intensive care is 2,200 euros. Yes? So when you can spare that,
yeah.
So the netto equation is very, very positive for vaccines. So that's why we encourage all people to have been vaccinated as soon as possible.
Yeah. Even in Tanzania, what we started now is old people, like from age of, mostly they consider from 60, but it can start down to 45, but also with comorbidities like hypertension, diabetes, with other diseases like chronic disease like sickle cell and other diseases around. But also the people who are working in health industry.
Well, so we started with the old ones, then the second round was all the people here working in the hospital in the wards, and then everybody, let's say from 70 to 65, then the week after 65 to 60, and then
down.
And now also most of the students have been vaccinated.
So next year, hopefully, the exchange program will continue.
Yeah. No, so that's why it's so important also for we donated, the Netherlands donated a lot of vaccines which were ordered also to Africa and Indonesia in order to have, because you can only, when you get rid of the viral infections here in the Netherlands, but it's still going on in
yeah, it
Africa,
can come back in as a mutated virus, and
well,
nothing you can do. You have to change vaccine
you
again.
You need to have a global vaccination program.
Yeah, strategically, that's how you become safe, because as of now, people are traveling. There's no way you can keep one disease somewhere.
Yeah.
So, yeah, that's good strategy.